Forward to that. Well, January is National Mental Wellness Month. It's a great chance to respect our own mental health and look at it as part of our overall total body health.
In this segment, our Andrias White-Murdaugh speaks with an expert health strategist about this very important topic. Here's that conversation.
Black women face significant disparities when it comes to mental health. And today, I'm here with Dr. Margaret Larkins-Pettigrew, Senior Vice President and Chief Clinical Diversity Officer for Highmark Allegheny Health Network, to talk about these disparities and why they exist. Good morning.
Good morning. Thank you for having me.
Thank you for being with us. This is a really important topic, especially as we think about just the effects that the pandemic has had on mental health in general. And then we think about the specific population of Black women and what we have gone through, what we have experienced, especially in this present day. So your book, you're an author, in addition to your clinical profession, and you talk about this story within your book. Tell us a little bit about the book.
Yes, the book was my memoir, and it's called The Colors of My Heart. And it really is embracing your Blackness with your history, faith, family, and fear. It really talks about a journey of a Black woman who has lived through being a Black woman in this country, and the number of things that we are subjected to that cause us to have periods of mental illness.
Yeah, and as we were talking before the interview, you introduced this incredible concept, so well put into words, of weathering. What is weathering?
So weathering is a concept that's coined. If you think about having your furniture outside all winter long, and the more it's outside, the more it is weathered, it really tears down what the furniture really is. And that's what happens to women and Black women from the minute you wake up in this country trying to be a woman. But all women have this issue around making sure that they're trying to be the best they can be, whether they're in a supervisory role or whether they're working, just day to day. It is all this weathering that occurs, the micro, macro aggressions, just trying to be a woman to survive and take care of our families and our children.
Yeah, and that concept of micro and macro aggression may be new for some. How would you describe what a micro and macro aggression is, and how people of all communities might have caused a microaggression unintentionally?
Mm-hmm. Well, when you talk about women in general, it's things that refer to, like they call them sexist statements, but as in life, we know that we've had many people say things to us that really kind of get under our skin because it reflects, who we are, and which is not appropriate. But for Black women, micro and macro aggressions occur all the time. People ask us about your hair, things about our colorism. It's really something that has been challenging our entire lives. So, and that adds to this whole issue of weathering, and then really does tear down you as an individual. You can't show up with your authentic self. So that you end up really trying to juggle day-to-day activities around just trying to be the best you can be while you're taking care of your family and your community.
That is so true. And I think everyone can think back to a time where someone has said something that truly they maybe didn't intend, but it
Mm-hmm.
had a lasting effect on the individual. So that's critically important. Now, again, we are all in need of mental health care. So when we think about where to go, how to get started, what resources can we take advantage of that truly allow us to seek that level of mental care from healthcare professionals who can identify with us in the appropriate ways?
Absolutely. The first thing is to identify that you are in trouble, that you really do need help. And if someone around you, your family members, they can identify that you're in that space where you really do need help, and then really reaching out for it and making sure that you are open to that. The first place to start is with your primary care provider, that person that you are with on a regular basis, hopefully yearly basis, that really can see the changes that have happened in your life. And you can talk to that person. Your community health centers. If you don't have insurance, there are federal qualified health centers that will help you and get those resources. And that is really your family, your friends, and your community that has to wrap around this concept of mental illness so that you can get to mental wellness.
Absolutely. I love that concept of mental wellness, getting to that point. It truly is a balancing act. You don't arrive at mental wellness and stay there forever. You've got to continue working through it and working with professionals who can assist you. Thank you so much for being with us and enlightening us and reminding us of the importance of mental wellness.
My pleasure. Thank you for having me.
For those of you who are interested in learning more about how you can seek mental wellness, we invite you to our website at wtbr.com/VTM.